Hello, pharmacists and friends. Today is October 30th, 2023, the alleged start of Pharmageddon. And welcome to the Regimen, where public health pharmacists, pharmacy students, and our guests discuss the latest public health issues. Listen in to find out how pharmacists and pharmacy students like me can improve population health, health equity, and patient care through advocacy and education. My name is Elisa Perino, and I'm a final year pharmacy student at the University of Rhode Island, working with the Rhode Island Department of Health alongside my professor, Dr. Bratberg.
And I'm Jeff Bratberg. I'm the clinical professor of pharmacy practice and clinical research at the College of Pharmacy and the academic collaborations officer at the Rhode Island Department of Health. As a reminder to our listeners, the opinions expressed in this podcast by us do not represent the opinions of the United States government, the Rhode Island Department of Health, nor the University of Rhode Island.
In today's episode, we're going to be having an important conversation about pharmacists' work conditions and burnout. And specifically, we're going to be talking about the USA Today article called Prescription for Disaster.
Yeah, Elisa, you mentioned Pharmageddon, which is a rumored walkout to be happening in chain pharmacies across the country today and earlier in this week. And some say maybe up to 5,000 pharmacists. Right now, as we're recording, we don't hear anything, but I think it's so important that with these major news outlets reporting on pharmacists' work conditions that we comment on it on the podcast.
Definitely. And so on Thursday, October 26th, USA Today published a story based on a series of interviews with 4 current and former pharmacists from different chains across the nation and spoke with industry leaders, patient advocates, and patients harmed by pharmacy errors. The individual stories shared in this article gave a really honest picture of the need for change in the working conditions of pharmacists, sharing some vulnerable stories of real scenarios showing how it can ultimately lead to mistakes and patient harm.
And why we're reporting on this is that this is actually causing an even greater change in the profession. People are leaving the profession, or at least leaving these important roles, experienced pharmacists working in community pharmacies. And we're seeing fewer people wanting to go to pharmacy. That is the face of our profession, is really what people think of pharmacists in those community settings. And so we want to, just like with our student recruitment podcast, make sure people are aware of what this is. And really the regimen is advocacy for public health.
Yeah. And it's really important to acknowledge as we get started that as pharmacists, we are the most accessible and visible points of care for primary patient-centered care and our communities. So we have the knowledge and the training to provide a wide range of services, including things like smoking cessation counseling, prescribing oral contraceptive and HIV PEP and PrEP therapies. We offer the unique capability to provide population health solutions from screening to counseling and medications at the same time, at the same place. So these services are proven to expand access, reduce overall costs, and even increase pharmacists' professional satisfaction.
So that all sounds great. We should be doing it. But these expanded services are, while they're instrumental in increasing patient access, most especially vaccines, they add to an already heavy workload just of regular prescriptions and accurate prescription filling and dispensing and counseling. And often these other services aren't reimbursed as they are in other health professionals. So now we have pharmacists who are taking on increased prescribing, increased dispensing, without any reduction in their existing duties, sometimes with a reduction in the number of hours to actually complete those fills, also reduced hours of our experienced personnel like technicians. Sometimes there's one pharmacist who's doing all of these things. And that's where the title of the USA Today article comes from, Prescription for Disaster.
And really when healthcare workers are stretched too thin. So this is when we really start to compromise the quality of care that we're able to provide. It increases the risk for mistakes. And some of the stories in the article shared this. One of them is from Florida. It tells the story of a child who actually overdosed on a newly prescribed anti-seizure medication after receiving it from the pharmacy with the wrong instructions on the label. And this is a really real problem, something I've actually seen working as an intern, where it was a patient receiving levofloxacin instead of levothyroxine, which obviously is a big difference and can really be harmful to our patients. And it's just a result of having too much to do and too little time, being stretched too thin.
So while, of course, every profession, thousands of pharmacists and thousands of pharmacies. Their mistakes will happen. We do our best in healthcare to do that. And there's not some perfect system staffed by dozens of pharmacists in each store that will prevent that. But the pharmacists quoted in the article, and again, dozens and dozens of pharmacists were interviewed over many months, say these are the examples of how working conditions, not their training or education or their systems, but really the working conditions, these workloads, put patients at risk. And when you can't do the thing that you committed yourself to do, these are dedicated pharmacists, they're getting burned out and they're quitting the profession. And hence why we're talking about this on the alleged start of Pharmageddon, where pharmacists walk out, as we've seen in so many other professions when they're not getting paid, the workload is too much, or their pharmacies are closing, especially in the communities where pharmacists actually are essential to providing care that may not be available in healthcare deserts or actually pharmacy deserts. So it's really incumbent on us to keep these pharmacies open, serving the public, serving these populations.
Yeah, so what we can do to kind of help address this issue is, of course, it starts with recognizing that there is an issue here, talking about it like we are here today, and on the news like that USA Today article that we're talking about. We already know as pharmacists how to advocate for our patients in hospitals, clinics, in the community, but now more than ever, we have to advocate for ourselves and for our profession so we can continue to increase the health equity through expanded access to safe and effective medications and health information.
That's right. We provide such a great service. We've been leaned on in COVID pandemic, saving tens of thousands of lives and preventing hospitalizations through vaccination services, meeting people where they're at. But we must advocate for pharmacists to be not only providing these services, but they have to be compensated for it, and not paying pharmacists more, but making sure there's enough pharmacists. Ideally, at minimum, 2 pharmacists working so that patients and communities can get not only the services, but the accurate, safe, and effective medications and education that they deserve. So by providing this care, we make sure that patient outcomes are achieved, boosting revenue. These are businesses, they must stay afloat, and encourage that there's better scheduling of pharmacists and technicians to reduce the burden from just, again, one often overworked, as described in this article, pharmacists, to achieve a safe level of care that the public expects and really the public deserves.
And I believe this concludes everything we have to talk about today. Be sure to follow us at PharmDPubHealth on Instagram, connect with us on LinkedIn, and turn on post notifications so you never miss an episode. Hit that subscribe button now on Spotify, Apple Podcasts, YouTube, Amazon Music, and wherever else you listen to podcasts. Thanks.